Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello. This is a live recording that I'm doing, and if anybody jumps on, that'll be great. We would be happy to have you on. It's new for me, but I want to let you know I have joined TikTok. It's been 3 days that I've been doing things on TikTok. I'm telling you, I'm killing it. I'm having a great time. A lot of people are enjoying the short videos. I'm noticing that you all like the shorter ones, little pieces and parts of what's going on with my actual YouTube channel, which I do things on the StreamYard. And so there are longer videos that do more teaching on my YouTube channel at Body Imbalance 25. And if you don't want to do that, you can meet me on TikTok. Yes, I'm on TikTok, and it's charla.v as in Victoria .Johnson. So it's charla.v.johnson on TikTok. And so what I'm going to be doing is chopping up some of this and add him in. Right now, we're going to be talking about outer ear infections, or what we call swimmer's ear. Swimmer's ear. It's a pretty painful situation. So I want to give you guys some tips. I want to tell you how to prevent it and that kind of thing. We're going to move the slide and we'll talk about what we're going to be talking about. This is what we're going to be talking about. Meeting this program is the introduction to the outer ear. Now, those of you that have been following me on my YouTube channel, I have been educating you to what the ear canal looks like. You all that have been following me should know there are 3 parts to the ear: the outer ear, the middle ear, and the inner ear. We're going to be talking about the outer ear, which is the canal, the outside, those flaps that God stuck on the sides of our head. Some of us, he's used for comedy and made them really big. You guys leave Obama alone. Or President Obama. Leave them alone, you guys. But they're there to collect sound. That's there to collect sound, but then it funnels the sound waves into the ear canal so that it hits the eardrum, and then it starts those 3 little bones in the middle ear to moving around. There's a whole lot of shaking going on. And when that happens, it stimulates, it goes from mechanical energy or vibratory energy into electrical energy when it hits the cochlea. And that's how it stimulates those hair cells in the inner ear within the cochlea, which goes to the acoustic nerve, which is the hearing side of the nerve. But there's a vestibular part of the nerve which keeps our body's proprioception or our balance together, and it goes to an area in the temporal lobe, which is the side of our heads, what we call the temple. In the temporal lobe, that part of your skull covers the temporal part of the brain, which houses our hearing. Okay, gave you that really quick. We're just going to be talking about when you get sick in your outer ear, causes, risk factors. Oh, I'm going to give you the rundown on that. You all are doing that to yourselves, shoving all these different things in your ear to scratch your ear and stuff like that. We're going to talk about it. Symptoms and diagnosis, things that happen so you'll know when you need to go to the urgent care or when you don't need to go. But this will be very informative. That's what it's all about. Body Imbalance 25 is all about letting you know what's going on with your body so you can make better informed decisions. Treatment plan. So let's check it out. We're going to check out the definition of swimmer's ear. So what really is swimmer's ear? Do you have to be a swimmer to have swimmer's ear? Well, of course not. You don't have to be a swimmer to have swimmer's ear. There's things that can trap in the inner ear or in the ear canal. If you look over there and it says external acoustic meatus, external acoustic meatus. I am saying these words because I'm still paying my school loans, but I want you all to understand what's going on. That ear canal where you can shove your finger in there, that is the external acoustic meatus. You can share that at the next family reunion or the next barbecue you have for Labor Day, and show everybody how smart you are. So the external acoustic meatus or your ear canal is the cause of swimmer's ear when it gets infected. Now, it's usually moist, warm, and dark, which is a great vacation spot for bacteria such as Staphylococcus, Streptococcus, and fungus, namely Candida. Oh, oh, Candida. No, that's just a song, but I'm going to go back to the fungus. Those are common bacteria and fungus that live on the skin. Those common bacteria that live on the skin, remember, the skin is a barrier. It is a barrier. So it keeps bad things out from getting inside of the body, causing infection. When you break the skin, now you've broken the barrier, the thing that God gave you as a protection, you've broken it. And now these things like staph, strep, and fungus can get in the skin, deeper layers, and start making infection. Because one or two so I'll do it kind of scripturally for those that know the Bible. When you cast out one demon and you sweep it away, you get rid of it, but then you open yourself up to something. Not just one comes back, but 7 come back. Well, there's 700 bacteria that will come back if you break your barrier. If you wipe away or somehow make a hole in your covering, okay? Then that's how you get the infection. So the ear canal, like I said, is nice, moist, warm, and dark. That's a great place for bacteria to grow and fungus to grow. All right. Let's move to the next slide. And you will see. Let's talk about that anatomy really, really quick because you guys know all about it already. You guys are experts that have been following me on Body Imbalance 25. Anatomy of the outer ear. First, there's the auricle. Again, the flaps that God stuck on the side of our head. It's called the antihelix, that rounded part, and the helix. Those parts you can see. Then you have the external acoustic meatus, or the ear canal, that functions to protect. That's the last part of the outer ear. What splits the outer ear from the middle ear? Well, I am so glad you said that. Yes, it is the eardrum, which looks like a tambourine, by the way. And so when you hit it, it vibrates. And when it vibrates, oh, I felt something right there. When it vibrates, then it stimulates those bones, okay? So your eardrum is an endpoint to the outer ear. Anything after the eardrum, now you're talking about middle ear. We already talked about middle ear infections. We're going to talk about outer ear infections and how they manifest. Okay. Common causes of swimmer's ear. Well, it can be bacterial, as the two that I just described. Now, there are other bacteria, but those are the most common ones. We all have staph, strep, and fungus on our skin. It doesn't matter how clean you are, how dirty you are. It's more of those numbers of bacteria on the guys standing around the burning trash can in the alley with the 40 ounce in their hand. It's probably more on them because there's less water activities that they may experience concerning compared to those who take more baths and showers to wash away an exorbitant amount of that staph, strep, and fungus on our skin. Those of us that wash more have less, but we all still have it on our skin. It's part of the protection. They call that normal body flora. Normal body flora. Okay, so foreign objects, i.e. pins and bobby pins and Q-tips and long nails that scratch inside the ear are those objects which will irritate and break the skin, leading to an infection, and that causes our problems. So keep those rat tooth combs out of our ears, keep those pins out of your ears, keep those nails, especially those Edward Scissorhands nails, those long, really long ones that are pointed. I think they're called almond shaped, that go in there and really just go to town. You're really ripping the skin off of the inside of your ear to make sure that you can get more fellow bacteria to just join in and have a good time. Have a good time. Have a good time. Yes, they will. All right. So the environment that causes this is when there's water exposure. So that's why they call it swimmer's ear, because swimmers tend to swim. Of course, they're going to, if they don't dry out their ear and it's wet a lot and it stays wet, water gets in there, it can cause infection if you've broken your skin. It usually doesn't happen if the canal is fine. Now, what happens if you get in standing water, i.e. lakes and ponds? They have far more bacteria in that kind of fresh water than you would if you had even in ocean water, because ocean water has salt, and that high abundance of salt does your body good, because the high abundance of salt tends to kill a lot of bacteria and it kills a lot of things. That's why we use salt to rub on meats. They used it years ago to preserve food and hold food and keep it, because salt tends to kill certain bacteria. That's not the case in lake water and pond water. That's why you have to be careful going into those. Make sure you're reading the signs to see the bacterial level, because that stuff can enter in to our body through the orifices or the openings, i.e., in our nose, in our mouth, when you go underwater in that nasty water, or when you go into get it in your ears, if you have like tubes in your ear and things like that. I told you about making sure your kids have earplugs to keep that from being a problem for them when they have tubes. Now, bath water, shower water, pools like at the YMCA. Do they still have YMCA? I think they do. But all of those places that are public pools that have chlorinated water and you can smell the chlorine like 2 miles down the road, those don't have as much bacteria that can cause you problems with your ears. Humid places like hot places in Florida or hot places in Georgia and South Carolina, North Carolina, Virginia, those hot areas. Now, well, you say, hey, we were at the AIM convention. It was 118 degrees in Phoenix. That's dry air, dry heat. That's not the same as that humid heat. So when you have that, it causes more sweating. And when it's sweaty, you sweat inside your ears also. And so you set up yourself for infections if you don't shower and clean that out. Now, when you, so I just talked about sticking objects in your ear. So how would you, let's look at some of the risk for the populations that this occurs. Kids a lot. They do a lot of scratching of their ears. They put stuff in their ears and that kind of thing. They like to swim a lot. And so if they swim in areas, their immune system is not as strong as adults. So they haven't developed a lot of fight in their body to protect themselves. So they get ear infections fairly rare. Now I want to talk to a population out there that has a skin condition called eczema and a really bad skin condition called psoriasis, where the skin is very, very dry, very, very dry. And it also breaks a lot and cracks. That being the case, it makes openings for infection. So those of you that have eczema and psoriasis, you need to make sure that you are upkeeping with your dermatologist, your family practitioner, your internal medicine doctor. Make sure that you're keeping up with them to have the appropriate type of steroid ointment or steroid drops. You can get those from your ENT docs too, steroid drops. I usually try to make sure that that is taken care of. Now, why am I showing you this? Well, because you need to know. And this Body and Balance 25, this show is about keeping you informed. And so, typical signs and symptoms are ear pain. This hurts badly. There's only so much room in the ear. So when it swells, it hurts. You can only have so much cells or so many cells in one spot. When you start adding more things in, something is going to get squeezed. And when that happens, when it swells up, it gets tight, it hurts, it's painful, it throbs because blood is circulation to the area. That's why if you look at that ear, it's red, really red. That's because there's a lot of blood circulating and it feels warm to the touch. It's painful. So ear pain is common. The second thing is it will itch really bad. If it's fungus, it really itches. And it turns red because the skin starts to get irritated. You get that redness is an indication that you have starting to get what's called cellulitis, an infection of the surrounding tissue and cells. Swelling and discharge comes out of the ear. You'll see like pussy looking stuff. And if it's fungus, it has a bad odor. You have hearing difficulties because your ear canal, which was open like this, is now closed up. And so it's swollen. Now, what are those little things, those little white things that I have next to it? Well, man, you guys are so intelligent. I'm so glad you asked me what they are. They're called wicks. Now, you will not see wicks normally in a regular doctor's office. So if you go to their office and your ear's swollen really, really bad, they're going to just ship you off to us. If they do not, or if you go to urgent care, sometimes they have wicks that they will place. But what it does, it goes into, so here's the ear canal. We take that little sponge and slide it in. Yes, it is painful. Yes, it is a little painful, but we slide that in and then we put some drops of medication. If anybody's seen a sponge, when you put water on it, it swells up. That's what those do. They will swell up, stay inside the ear canal so that the medicine can get in there. If a doctor, urgent care doctor, your family practice doctor gives you an antibiotic that's a drop, and your ear canal is swollen like this, the drop just drops on the top and sits. So it doesn't get in there where it needs to go to. That's why you need a wick. Okay. So if your doctor gives you drops, your ear is really warm and swollen, and you put the drops in for a few days, then I'd be running around looking for your friendly ENT so they can help you by placing a wick, and within a few days, your ear will get better. All right. Now, what are the medications? The most inexpensive eardrop you can get is the neomycin polymyxin sulfate. It has a steroid in it. Now, notice that this one says ophthalmic. Ophthalmic is for the eye. There is another one called ofloxacin. It says otic, that's for the ear, but you may have one that says ophthalmic. Listen, key point. Ding, 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 ding. Key point. Ding, 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 ding. If your medicine says ophthalmic, but you went in to see your doctor for your ear, place that in your ear and not in your eye, because if you put drops in your eye, you're not helping your ear at all. Zero, zilch. Well, why did they give me an eye drop for my ear? Well, let me tell you why. Because it is less expensive to use the ophthalmic drops than it is to get the otic drops. So we look out for your wallets by giving you the eye drop instead of the eardrop. Okay. So if you do get the eardrop, then your insurance covers it pretty well and it's inexpensive, that's fine. Now, you can put the eye drop in the ear, but you cannot put the eardrop in the eye. Let me say that again. You can put the eardrop, the eye drop, you can put the eye drop in the ear, but you cannot put the eardrop in the eye. So if you get an infection in your eye, like pink eye or something like that, do not, ding, 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 do not put the eardrop in your eye. All right? You can go the opposite way though. So antibiotic drops are used for the infection. They usually have a steroid in them. Now, ofloxacin, plain ofloxacin does not have a steroid. So if you don't have a lot of swelling, but you have some redness and the ear canal is open and you can get the drops in there, they'll usually give you just ofloxacin. They may give you the neomycin polymyxin. Okay, another tip for my fans out there. Don't use neomycin polymyxin, and remind your doctor if you have a sulfa drug allergy. If you have a sulfa drug allergy, when you put the drops in there after 2 or 3 times, you're going to have more swelling of your ear, more redness, and a rash, which will develop pus and have that stuff coming out because you're having an allergic reaction to that drop. You don't want to have an allergic reaction to the drop, so you got to let them know you can't take a sulfa drug. So neomycin polymyxin B sulfate, you can't use it if you have allergies to sulfa drugs. Most of the time, your doctor should know that, but if they don't, just give them a friendly reminder that you can't take it. The other people that should not use this drop, if your child or yourself has tubes in the ear, that is not the drop to use for you. Because if the drop gets through and goes into the middle ear over a 10-day period or 14-day period, you can cause damage to your hearing because it causes nerve damage and makes you have hearing loss. So you don't want to use that if you have a hole in your ear. Say you don't have a perforation. You don't have a tube, but you have a perforation, which is a hole in the eardrum. You still don't want to use that because now you still have a way to get into the middle ear, which gets to the inner ear. Okay. Next thing I want to make sure that you fully understand, know, and realize is that you want to keep the ear dry, but you don't want to use a Q-tip to swab the deck because when you do, you're peeling skin off of the canal, which sets you up for infection. If your ears are wet from the shower and from you washing your hair, take your towel, kind of twist it up, stick it inside your ear, lean over, and let the water dry. Let it catch the water, just like that. If it still feels wet, take a blow dryer and just run it by your ear 2 or 3 times, and that'll dry it up quickly without you breaking your skin. Okay? Preventive measures, I just talked to you about some of them. Always keep your ear dry, especially after you swim. These things that you see here are earplugs that are used to keep pond water, lake water out of your ear. Okay? If you decide you want to go swimming in that environment. Rivers are not so bad because the stream is flowing. And so there's always the movement of that water, which kind of cleanses it when it hits rocks and things like that. Oceans has the salt. Public pools has chlorine. And then your regular outside pool, it's not likely to have a lot of bacteria in there. All right. So you want to use plugs when you're going into those other environments, lake and pond, most definitely. You may even want to use a neoprene sleeve or a swimming cap to hold those in. The other thing that you want to do is make sure that your ear is dry. There are some drying agent ear drops that you can use, and you can find those at any drugstore. All right. In conclusion, I've given you some causes and symptoms of the outer ear infections. That is the otitis externa is what I would have to use because, like I said, I'm still paying my school loans. So otitis externa is the same thing as an outer ear infection or swimmer's ear. Keep objects out of your ear. Do not put bobby pins, the top of a pin, paper clips, rat tooth combs, or those Edward Scissorhands nails in there scrubbing. Don't do that. If you do break the skin, or if you have psoriasis or eczema really bad, you want to go to your regular doctor or a dermatologist or your friendly ENT, and we will give you steroid ointments, steroid drops. One of the great steroid drops is something called dermatic oil. Dermatic oil. That is a really good, helpful drop for those of you that have really bad itchy ears. You may want to talk to your doctor about that. Now, timely treatment. If you notice that your ear is feeling warm to touch and having pain, go see your doctor so you can get started on an antibiotic before it gets really bad. The next thing you want to do is proper ear hygiene. Make sure that you keep a whole lot of wax out of there. We talked about that. I've got plenty of videos out there about making sure you keep your ears clean from wax so that you don't get swimmer's ear complications. All right. So that is today's episode on otitis externa, or outer ear infection, or swimmer's ear.